Understanding the patient's journey in your practice, in your office, in your clinic, in your business is probably the most important thing to do in your business. When you don't understand what I call the ecosystem of your business or your patient life cycle, then that creates more work for you, your team, and your patients. Yet, if you haven't mapped out your patient's life cycle and understand all the interactions and touch points in your patient's life cycle, then I will promise you, you are chasing the wrong metrics. Let me give you a couple examples. Are you constantly going after your cancel rate? Are you constantly going after billing problems? Are you constantly looking to change no-shows? All these are a direct result of not understanding your patient's life cycle. Are you currently measuring drop-offs? If you aren't, you must. If you are, then that is your indicator, your guide, your gauge to your complete patient life cycle. That will tell you when your life cycle is going well. It'll tell you when your patient's life cycle is not going well. And if you understand your patient's life cycle and you know it's not going well, you can immediately move to that point where the problem can be solved long term. If you're trying to chase cancels, then you're yelling at your providers, you're yelling at your front desk, you're imposing cancel fees, you're raising your cancel fees, you're using threats to try to get your patients to arrive. That is a clear sign that you do not have your patient's life cycle mapped out and that you do not understand all the interactions and touch points that occur to change a cancel rate. And again, the number one metric is drop-offs. Do you know your drop-off rate? When you have mapped out your patient life cycle, you will have a happier team. I guarantee it. When you map out that patient's life cycle, every team member understands their role in creating patient success. And I'm going to tell you right now, here's another test of if you understand your patient's life cycle and all the interactions and touch points. How much load are you putting on the providers for a completed plan of care, for patient visits? Because patient visits, again, you'll notice I said completed plan of care first. Patient visits is a useless metric in the world of understanding your patient life cycle. And if your provider's main accountabilities are patient visits and units billed, you do not understand your patient's life cycle. So when we do understand that patient's life cycle, when you understand it, we can give some of that work to the front desk. We can offload the provider, give some of that work to the front desk. Now, mind you, we're not adding work because it's work they should have been doing already, because I'll argue you made them into taskmasters because you didn't know the role they played in patient success. So how many tasks does your front desk have to do every day? And how does it relate to patient success?